Hello, my name is Prachi Dev. I'm an engineer by training and have worked in the technology space. My work lies at the intersection of health and education. I founded a non-profit Nai Disha, which is now into its ninth year of operation. Um, I have an elder brother with Down syndrome, and it is my journey and my lived experience as a caregiver that has led to the genesis of Nai Disha. So Naidisha works as a lifelong partner for families who are impacted by autism, Down syndrome, or other developmental conditions. We help families with information, guidance, provide them with hope so that they can provide support to their children to enable them reach their true potential. Technology is core to the work that we do, and we have been able to successfully marry technology with community. While our work is focused on developmental disabilities, I think this model applies to any healthcare settings or complex health conditions that are caregiver heavy. This can be complex conditions like cancer, Alzheimer's, or mental health conditions. Um, I'm often asked, how do you scale your work and how do you reach maximum families? Working with communities, the answer comes naturally to me that it is important to build local communities, communities that are replicable, and that's the most sustainable way to scale. Having said that, to make the community itself sustainable, it is important to have local leaders, leaders from the community who understand the local challenge, local problems there, and can work with other community members towards solving those problems. And hence, I chose enabling parents as champions for running, sustaining their own communities as the project with WomenLift. Uh, I'm happy to share that we have received a donor grant. We are just about there. Um, and we have identified 4 locations where we have started with parent communities, have frequent interactions with the parents to recognize people who are active, who want to make a change, who want to help other parents as well. We spoke to them about the program, told them about the roles and responsibilities, what is expected of them, what we would provide, the support we would provide to them. And we have had 17 parents sign up as parent champions. The good news is 3 out of these 17 parents are fathers, which helps break the stereotypes around caregiving, which is recognized as a woman role. Um, we have formulated a four-step program to enable these parent champions. Um, it is semi-formal in structure because we have to recognize their caregiving constraints and at the same time identify what will inspire them as well as incentivize them to contribute to the cause and build their community. Um, I went in with an assumption that it was us who would create the curriculum for this program. Um, However, with frequent interactions with these parent champions, we have had 3 meetings so far. It became apparent that they were leading the way. They recognized the local problems in their communities that they wanted to solve, and they made it very apparent that these problems were important to them, which led to creating that curriculum, taking into account their needs. I think we have been able to create a healthy mix in terms of open discussions, in terms of experiences shared by people who have tried to solve these problems, and some talks by experts in the field. I also asked parent champions on why did they join this program. Some answers were apparent to me to help other parents, but what was interesting was that parents who had been doing advocacy in their own right had joined the program, and I asked them, why did you need to join this? You could have done this on their own, on your own. And they came back saying, no, this provides us with a platform. This helps us connect with other parents who are trying to do this in their communities. This helps us uh, um, understand what's happening in the local communities and how we can learn from other regions as well. Um, as I said, we are 3 months into the program. We are making little progress day by day. We are seeing increased interaction in our support groups. We are seeing that some parents have come together to form their play groups. They have discussions around having camps. Having said that, this is just beginning and we have a long way to go. Uh, WomenLift program has helped me step back and look at my journey, reflect on my journey as a leader. It has helped me identify my own strengths, my own weaknesses, and made me think about how I want to proceed and shape my journey as a leader. I would say I was agnostic to gender. I was agnostic to power and privilege, and Women Lift program has helped me recognize these nuances around power, privilege, and diversity. And I hope to bring these learnings and the intersectionality of it really into my work. Thank you so much.